Okay, good morning. Thank you very much. And I am actually Dr. Amy Wetherby, and you know, my grandmother's name was Anne, so I appreciate that. I appreciate that very much. And I am at Florida State University, and I am honored and delighted to be here this morning to share information with you about a number of different projects that I've directed and try to integrate it with current research findings on children with developmental disabilities. So I'm going to begin with one of the major problems that we're addressing in our research. And that is that the estimated lifetime society cost for a child with autism is $3.2 million. That's a big problem for all of us, and we need to really come up with creative ways to help address this. First of all, autism is no longer uncommon, so it makes this problem even more important. Recent CDC figures, 1 in 68 children have autism. The median age for diagnosis in the United States is over 4 years of age. Intervention has the greatest impact if it begins before 3 years of age. So the problem is really multifold and includes both improving early detection as well as access to early intervention. The federal mandate for early intervention through the IDEA Part C is exciting that it's there, but the problem is it's not working, or it's not working well, I should say. 80% of children who will need early intervention and be eligible for services when they get to school age are missed and don't ever even get identified or receive early intervention. So let's take a look at who these children are and how we might address this better. So at school age, 11.4% of school-age children are eligible for special education. At preschool, we serve half of that, 5.7%. Half, so half are missed, depends on half full or half empty. Infants and toddlers, so that's the birth to 3, is 2.5%. So the 2.5 from the 11.4 gives us the 20% that we're serving, 80% that we're missing. Now, these are the children that we serve at school age. So these are the children, the students that we want to catch in early intervention. And so the largest is specific learning disabilities on down to autism at 4% and then low incidence disabilities. If you think about these different categories, all of them, if not, well, most of them, if not all of them, are going to show a language delay at preschool for many different reasons, and a communication delay in infancy and toddlerhood. So communication is really a good way to find these children earlier. The other problem is where we draw the line. And so you know the bell curve quite well. Most states, partly because there's not enough funding for Part C, early intervention, have drawn the line at the 2nd percentile. That's 2 standard deviations below the mean. If your cut score and your screening tools are geared to pick up children 2 standard deviations below the mean, you're never going to get past 2%, because that's the 2nd percentile. So that's part of the problem. Very quickly, this is old research. 1 in 3 children in our country have challenges learning to read. We can predict high school graduation with good accuracy by 3rd grade, and probably even by kindergarten. Trajectories are established early. These are reading trajectories from 1st to 5th grade. Just looking back then at 2nd grade, we start to see that the poor readers with lower scores progress at slower rates. And if we go to 1st grade, we really can't pick them out until the end of 1st grade if we use standard reading assessments. So we need to go earlier and be able to find children who are at risk for academic challenge or failure. We know from the preschool research that there are 3 key skills in emergent literacy that predict very accurately 3rd grade reading, kindergarten performance. Phonological sensitivity, or the ability to sound awareness, print knowledge or letter awareness, and spoken language, or the ability to talk. So let's take a look at 2 children. Which one? These are children are 18 to 20 months of age. Which one do you think is going to have a problem reading? We followed these children through the First Words Project, invited them in when they were 3, and asked them to draw a picture of themselves. You can already tell. Hannah on the left, draw a beautiful picture of herself. Josh did not. So he's already showing signs of reading challenges at 3. Asked them to write their name at 4. You can even see the letters in Hannah's name. We don't see any letters in Josh. So we are already seeing problems. You probably have heard about the 30 million word gap. This comes out of the foundational work of Hart and Risley, which has shown us that there are cumulative differences in language experiences that may be insurmountable by 4 years of age. And these show huge gaps in the amount of language in the learning environment of children from parents who range from professional education to working class to welfare. And so the families on welfare spoke an average of 600 words per hour compared to 2,100 for professional families. And if you work this all the way out to 4, that's a 30 million word gap in terms of the words that children hear in their language learning environment. This is directly correlated to their vocabulary growth, which predicts IQ in 3rd grade. So these trajectories are quite large at 3, and so if we can go earlier, before we have these large gaps, we may be able to provide particularly cost-efficient and effective early intervention. So going back to Hannah, at 19 months, we saw that her social communication skills indicated she was going to be a good reader. And Josh, at 20 months, his social communication skills indicated he was not going to be. So we know that he needs help at this young age. We don't need to wait. We don't need to wait. A child's rate of language acquisition is solidified, and their trajectories are really already formed by 2 to 3 years of age for language learning. And this is correlated, as I said, with IQ. So when we think about school readiness, we really need to think about earlier. Interesting new study that was quoted at a U.S. Department of Education, Institute of Education Science project director meeting several times that was just held last month, which is another compelling reason that we need to get children with disabilities ready for kindergarten. Based on a recent study of 1,300 students with disabilities between 6 to 9 years of age across 180 schools districts, the more hours spent in general education, the better their outcome. So that's very important to think about. So what we have our eye on is getting children with disabilities ready for general education kindergarten. And that doesn't rule out special education, it just changes their role to one of supporting general education teachers. We started the First Words Project about 12 years ago to improve the detection of communication delays, including autism, and really focused on children under 24 months of age. We've screened over 20,000 children in our region. We screen about 1/4 of the birth rate. And what we're finding is that instead of waiting to see if a child is delayed in language and at risk for reading, we are able to predict reading and language with skills that come in before language. And these predictors, we have 8 of them, include sharing attention and interests, a child's ability to communicate, their rate of communicating, reasons for communicating, their inventory of gestures, their inventory of sounds, understanding of words, their variety and level of play actions, and their book knowledge. So all of these different skills can give us a lot of information about what's coming, language development and reading success and success in school. I want to go through inventory of gestures quickly as one example, but keep in mind this is one of 8 very important early predictors. Research shows that the development of gestures between 9 and 18 months of age predicts language 2 years later. Furthermore, research shows that the socioeconomic disparities that were demonstrated in the Hart and Risley study with vocabulary are also evident in early gestures. And so they also are children from lower socioeconomic levels show later development of gestures as well. Let's take a look at how gestures develop. Children should have at least 16 gestures, excuse me, by 16 months of age. 16 by 16. Let's watch them come in. At 9 months of age, a child should use, and I'm going to give you the average gestures and how they come in. There's variation, but some children will use some of these earlier, some later, but they should have at least 16 when you get to 16 months. So give is commonly one of the earliest gestures. It comes out of give and take. Children learn to take objects and then to give them. First, they may drop them, and the parent's really good at catching, and then they learn what the give gesture is about. The head shake comes in early because, again, the child learns by pulling their head away when food that they don't like is offered, and then they look back. The food's magically removed, and they get the power of the head shake. 10 months, reaching, which comes out of, again, raising your arms, anticipating to be picked up, or reaching out to take something. Children then learn to use a reach gesture, and then the open hand reach gesture, and then the raising arms in anticipation of being picked up. At 11 months, showing. Children hold out objects to show they're not giving them up. They just want you to look at them and share your attention on them. They learn to wave, but the early wave is not, they don't quite get the orientation of it, but they know they're supposed to be doing something up there with their hand, and later it becomes a mature wave. 12 months, children begin pointing, but it's usually with an open hand point and a reach, so they have their whole hand and they're really tapping to indicate. So they're getting the idea of indicating to draw attention to things of interest. 13 months, children are just beginning to learn through observational learning. So we begin to see clapping, we begin to see blowing a kiss, and look at the beautiful attention this child is giving on mom to watch. So that observational learning is very important for not only gesture, but many aspects of development. 14 months, we should see pointing with the index finger at a distance, so children can point across the room, across the pond in this case. And this is really the cusp of true symbol use, when children's words should be emerging, the double-handed point. And we also see gestures like the sh gesture, which is also the index finger, but learning the different meanings of these hand movements at the time as words are unfolding. So the gestures provide this great scaffolding for words. At 15 months, we may see a head nod and a thumbs up, and these are really equivalent to the word yes. And at 16 months, we may see other symbolic gestures, such as the I don't know, high five, and then, of course, the universal peace sign, in this case, a child who's hanging from the jungle gym. And so those are examples of gestures. So there's a rich opportunity to use this research across these 8 different skills to look for early lags in language development, really before language and communication development, to try to support learning sooner. The richest moments for early language learning are when the child and caregiver are sharing attention, and the caregiver talks about what the child's focus of attention is. And so we talked a lot yesterday about many different family-focused interventions that try to support this responsive caregiving, or the contingent responding that caregivers are doing. So children who are communication delayed aren't giving the parents the right cues to respond contingently. So in this case, this child who's typically developing is using his gestures and book knowledge, and his mom is following beautifully, and we have this perfect moment of language learning going on. And this is what we want to build. This is school readiness. This is the time when you can make the most difference. So let me shift back to autism for a moment. How can we detect autism earlier? Not just communication delays. So we've been developing a screening tool called the ESAC, Early Screening for Autism and Communication Disorders. And we're now developing, we have a brand new grant from NICHD to develop what we're calling the SMART ESAC. We're putting it online, and it's going to be automatically scored. And we have come up with, excuse me, the best 10 questions to screen for communication delay. So this could be done universally at the well child checkup. And then we have 20 additional questions if there's a positive screen for communication delay, which screen for autism. So we have 30 questions. We have good sensitivity specificity, promising, and our new grant will help us take this down to 12 months and maybe go down to 9 months. We've also been developing observational tools. So we have one called the Systematic Observation of Autism, the Systematic Observation of Red Flags of Autism Spectrum Disorders, which is based on the DSM-5. We have 11 red flags under the first domain, impairment in social communication, and 11 red flags in repetitive behavior. So what I want to do now is show you a video to illustrate the clinical assessment that we have developed and how you can see the difference between a very young child who's typically developing a child with autism. This clip shows Charlie during the CSBS, which is the Communication and Symbolic Behavior Scales, an evaluation tool designed for young children.
Wow!
Notice how Charlie shows interest in interacting and easily pays attention to both the bubbles and the people.
Stuck. Ooh. Pour it out. Take. It's stuck. Do you need some help? Okay.
You can actually see him learning. He watches, listens, and then imitates a word. I'm going to go ahead and pause it and move to this one. Now watch Luke in the same situation. Notice his early social communication skills and how they differ from those of Charlie at the same age.
Good popping. You got the bubbles. These are where the bubbles are. Open. Do you want Mama to help you? You want more bubbles? You need some help? Give us the bubbles. You do it.
Like Charlie, Luke showed interest in the
I'm
bubbles.
going to go ahead and
used a
pause
give
it
gesture
because I'm hoping that you saw. I want to go ahead and talk about intervention. So the signs are there early if you know what to look for. And if you're going to find autism early, then you need to provide early treatment. So I want to just show you videos to show you how we've come up with a family-focused intervention. We've just finished a randomized controlled trial. We're comparing individual and group conditions, group once a week, individual 3 times a week. And so we have teach parents very specific evidence-based strategies to embed into their everyday activities. And so I think you can see, I'm just going to go really quick because you can just see how we teach parents how to provide these supports and make the most of every moment in these activities that they're already doing. So we've tried to create a very efficient intervention to engage families and teach them the strategies. And so in 3 sessions a week, we've been able to document improvement in children's outcomes. Now, there have been a number of parent-implemented treatment, large randomized controlled treatments with children with autism, but they haven't actually impacted the child's outcomes. So these are our significant findings that we have just finished our study and have significant improvement and interaction effects with the black line is the individual, which does seem to have an advantage over the group, but we also had effects in the group. I'm going to skip this and just show you very quickly. So one of the advantages of working in everyday activities is that we really can affect diverse cultures because the activities are defined by the family. So one of our preliminary activities is to do some work in the KwaZulu-Natal region of South Africa. And so I just show you these photos quickly to let you know that we're able to adapt our screening and intervention procedures because it's all defined around their everyday activities. So I want to finish today by talking about the Autism Navigator. So we have developed a set of tools and courses that are built around the idea that a video is powerful to teach you. And I've shown you a couple of videos. I want to end today by showing you one more.
We developed the ASD Video Glossary and launched it in 2007 in partnership with Autism Speaks and First Signs. And so we are now coming up with a new tool which is using newer technology, and we're developing a whole set of professional development courses, 30 hours for early intervention providers who are really geared for Part C IDEA. We have embedded video, probably 20 hours of video of the 30 hours. We're finishing development of the Autism Navigator for primary care. This is a 15, maybe 5 minutes to 6 hour course. And I'm going to go ahead and skip. Well, I'm going to go ahead and show this. So what I want to show you is one of the clips in here.
Did you get it out?
And then I'll wrap up. I'll show you a little bit of this. Now that you've been learning about the features of autism, watch Elby, who's 20 months old, and see if you can find any early signs of autism.
Family are all gone. Spoon's all gone. Oh boy, now what you got? A whisk? Whisk. Whisk. That's a whisk. Whisk. Whisk.
Elby was not talking or trying to communicate. He did not look at or respond to his mom. You may have noticed how hard his mom tried to engage him, yet he did not appear to pay attention to her.
Spoon fall down.
He became intensely focused on the whisk. His mom was aware of his lack of responding. So it goes on about the features. I want to show you a little bit of the intervention. See Elby when he is 3 years old, at the end of ESI. This clip illustrates the impact of early intervention on both Elby and So this is actually a 10-minute clip. I'm just showing you little bits of it.
A little bit harder. Mama does.
I'm going to go up.
More eggs I'll be doing this time. Got egg. Yeah. Go crack, crack, crack.
Nice joint attention there.
Egg is hiding. There it is.
Oops. Up. Let me just show you one last bit of this at 3:09. Okay. There we go.
Yay! Yeah, you want to play?
And this is it. So it takes you from 20 months to 5.
Dr. Hide and Seek. We can, sure. I don't know how to play that one. You have to get some alive, and you have, and you have to count. Okay. Uh-oh! Uh-oh! Okay, how about I count? You want me to count, or you count?
Elby is now 5 years old and is in a regular kindergarten classroom. 2 years after their participation in ESI, you see his mom continue using the supports to engage Elby in interaction and play with remarkable change.
How do we play this game? This is how you play this.
So what's powerful is that we spent she was in the treatment study for 18 months, from 20 until 36 months, and she continued to use the strategies until he was 5. So the power of teaching the parents goes far beyond what they're learning when you're with them, but what they bring and the advocacy that they also bring. So he was a success, made it really, is doing well. He's beyond kindergarten now, is doing well. It doesn't mean he doesn't have autism. It means that he's functioning well in a group, a classroom, and that means that he's going to have a really good outcome in adulthood. So I'm going to now sum up. I'm confused on the time here. This clock is throwing me off. How many? Okay. So I'm going to wrap up, because my time says I only went 24 minutes. So that's where I'm a little confused, but I can wrap up. So I want to show you. I'm going to skip. I'm going to go ahead and skip, since I'm running out of time, to right here. Okay, so I'm going to do a summary. I was going to go through these one at a time, but I'm going to do it all at once. So what we're building with the Autism Navigator is what we're conceiving as an ecosystem, an electronic communication system, which has a tiered supports and services ranging from self-guided digital family tools, so some of those videos will be embedded into, we're building social communication growth charts, which will take parents through early gestures, those 8 different areas, about autism, which will, when they suspect autism, get a positive screen, will then take them into information about why it's really critical to start early intervention as soon as they suspect autism, and then a how-to guide, which will include online for parent to use as soon as you suspect autism, here's what you want to do to get started. Then we have an electronic monitoring system that we're going to be developing, which will have monthly check-ins through text, phone, or other means to stay in touch with the family so that we can check in. And this really came out of discussions with doctors saying, we want to know what happens after we refer them to Part C, but we don't have the time to call and talk to the early interventionists. So developing a whole platform. We have 2 different courses then that will support. There's a whole number of silos that was talked about yesterday that serve young children. We have the Autism Navigator for primary care, and the Smart ESAC is part of that, and so we'll try to get the primary care medical home at the center and teach these different silos. And then we have the primary care course for the Part C early intervention system. So it's a way to to bring the collaboration that was talked about yesterday all together. And I want to end with this notion that the early intervention system partnership is advocated by the American Academy of Pediatrics. This article came out in the fall, wonderful article, you can get it for free. And so we hope that our ecosystem will be a tool for all of the different systems, all of you, to help and achieve the goals that we attain. So I'm going to wrap up. We talked yesterday about the budget. So we've created a very creative business modeling. We have a for-profit company. The state of Florida asked us to form this so that we can roll this out. The state of Florida has invested with leadership in the Senate and House of Florida, and so we have our tools that we're building, offering them for free. We will need to charge for certification courses. All of the profits of the company will roll back into development. So I'm going to end early is key. Thank you.